In today's world, medications are a part of everyday life. From a simple headache to managing chronic conditions, we rely on medications to alleviate symptoms and improve our well-being. While they offer significant benefits, they can also have serious, often silent adverse effects. One of the organs most susceptible to medication-related damage is the kidneys. These hardworking organs filter waste products from our blood, regulate blood pressure, and produce essential hormones. Today, we're diving deep into 8 common medications that can potentially harm your kidneys. Always consult your doctor or a qualified healthcare professional about your specific health concerns or before making any changes to your medication regimen. By understanding the potential risks associated with these medications, you'll be empowered to have more informed conversations with your doctor and make safer choices for your health. Let's start with a class of drugs most of us have encountered: antibiotics. These medications are true lifesavers when it comes to battling bacterial infections. However, some antibiotics can be harsh on the kidneys. One group of antibiotics, known as aminoglycosides, are particularly notorious for their potential to cause kidney damage. These drugs, which include gentamicin and tobramycin, are powerful weapons against serious infections. But their mechanism of action, while effective against bacteria, can also harm the cells in your kidneys that are responsible for filtering waste. Another antibiotic class to be aware of is polymyxins. Like aminoglycosides, polymyxins can damage kidney cell membranes, leading to impaired kidney function. Now, this doesn't mean you should avoid antibiotics altogether. Remember, they're essential for treating bacterial infections. Instead, talk to your doctor. They can determine if an antibiotic is necessary and choose the safest option for your individual situation. If you're prescribed aminoglycosides or polymyxins, your doctor will likely monitor your kidney function closely during treatment. The key takeaway here is open communication with your doctor. Next up, we're discussing a class of drugs many people reach for to alleviate pain and inflammation: non-steroidal anti-inflammatory drugs, or NSAIDs. You probably know them by familiar names like ibuprofen and aspirin. While effective for pain management, NSAIDs can pose risks to your kidneys, especially with prolonged use. NSAIDs reduce chemicals that cause pain and inflammation. These chemicals also help maintain blood flow to the kidneys. Reduced chemicals can constrict kidney blood vessels, leading to acute kidney injury. Acute kidney injury can range in severity but is often reversible with prompt treatment. Recognize warning signs like decreased urine output, swelling, fatigue, and shortness of breath. Seek immediate medical attention if you experience these symptoms while taking NSAIDs. Let's talk about diuretics, often referred to as water pills. These medications help your body eliminate excess fluid through urine, which is particularly helpful for managing conditions like high blood pressure and heart failure. While generally safe when used as directed, diuretics can pose risks to your kidneys, primarily through dehydration. Think of your kidneys like a filtration system. They require adequate fluid to function optimally. When you lose too much fluid, it can strain your kidneys and make it difficult for them to effectively filter waste products from your blood. Certain types of diuretics, like loop diuretics and thiazide diuretics, are more potent than others and thus carry a higher risk of dehydration. Now, this doesn't mean you should avoid diuretics if they're prescribed to you. Instead, talk to your doctor about ways to minimize the risk of dehydration. Staying properly hydrated is crucial while taking diuretics. Your doctor can advise you on how much fluid you should be consuming daily, especially during warmer weather or when you're exercising. Monitoring your body for signs of dehydration is also essential. If you experience any of these symptoms, especially while taking diuretics, contact your doctor. Now, let's discuss a class of drugs commonly used to treat acid reflux and heartburn: proton pump inhibitors, or PPIs. While effective in reducing stomach acid production, PPIs have been linked to potential kidney problems, especially with long-term use. One concern is a condition called acute interstitial nephritis. This occurs when the spaces between kidney tubules, the tiny structures responsible for filtering waste, become inflamed. This inflammation can disrupt kidney function and lead to acute kidney injury. Another concern with long-term PPI use is an increased risk of chronic kidney disease. While the exact link is still being investigated, studies have shown a correlation between prolonged PPI use and a decline in kidney function over time. If you're taking PPIs and concerned about your kidney health, talk to your doctor. They can assess your individual risk factors, consider the duration of your PPI use, and explore alternative treatment options for your acid reflux or heartburn. Remember, it's crucial to have open and honest conversations with your healthcare providers about your medications. Moving on to medications commonly prescribed for high blood pressure, ACE inhibitors. These medications work by relaxing blood vessels, which helps lower blood pressure and improve blood flow. While generally safe and effective, ACE inhibitors can, in some cases, lead to a sudden decline in kidney function, especially when used in certain combinations or situations. One scenario that can increase the risk of kidney problems with ACE inhibitors is dehydration. As we discussed earlier, dehydration can strain your kidneys. When combined with the effects of ACE inhibitors, which can sometimes lower blood pressure too much in a dehydrated state, it can further reduce blood flow to the kidneys, leading to acute kidney injury. Another risk factor is combining ACE inhibitors with NSAIDs. As we discussed, NSAIDs can also reduce blood flow to the kidneys. Taking both medications simultaneously can compound this effect, significantly increasing the risk of kidney damage. Now, this doesn't mean you should avoid ACE inhibitors if you have high blood pressure. They're essential for managing this condition and reducing the risk of serious complications like heart attack and stroke. However, it's crucial to be aware of the potential risks and take precautions to protect your kidneys. Antiviral drugs, when viruses threaten your kidneys. Let's delve into a class of drugs that have become increasingly relevant in recent years. Antiviral medications. These medications are designed to target viruses, inhibiting their ability to replicate and spread within the body. While antiviral drugs can be life-saving in the treatment of viral infections, some of them can potentially harm the kidneys, particularly in individuals with pre-existing kidney issues. One antiviral drug that has garnered attention for its potential kidney-related side effects is remdesivir. Remdesivir has been used in the treatment of certain severe viral infections. It's important to note that kidney problems associated with remdesivir are more common in people who already have underlying kidney issues. If you have pre-existing kidney disease and are prescribed remdesivir, your doctor will likely monitor your kidney function very closely. Lithium, balancing mental health with kidney health. Let's talk about lithium, a medication commonly prescribed to manage bipolar disorder, a mental health condition characterized by extreme shifts in mood. Lithium can be a highly effective treatment for stabilizing mood and preventing manic episodes. However, it's essential to be aware of its potential impact on kidney health, especially with long-term use. Lithium is primarily excreted through the kidneys. Over time, prolonged exposure to lithium can put a strain on the kidneys, potentially leading to various kidney problems. One concern is a condition called nephrogenic diabetes insipidus, which affects the kidney's ability to concentrate urine. This can lead to excessive urination, dehydration, and electrolyte imbalances. Another concern is the potential for lithium to contribute to chronic kidney disease over time. While not everyone who takes lithium will develop kidney problems, the risk increases with long-term use, high doses, and pre-existing kidney conditions. If you're taking lithium for bipolar disorder, don't panic. This medication can be life-changing for managing your condition. However, it's crucial to work closely with your doctor to monitor your kidney health. Extra tips for cautious use. Let's discuss some extra tips for using medications cautiously to protect your kidney health. If you suspect your medication is affecting your kidneys, seek medical advice. Be aware of changes in urination patterns, such as decreased urine output or pain during urination. Look out for swelling in your legs, ankles, or feet, as this can indicate fluid retention. Regular checkups and open communication with your healthcare providers are paramount. Inform your doctor about all medications you're taking, including over-the-counter drugs and supplements. If you have pre-existing conditions like diabetes or high blood pressure, be extra vigilant. Staying properly hydrated is essential, especially when taking medications. Lastly, adopt a healthy lifestyle to reduce reliance on medications. Protect your kidneys. Protect your health. As we've explored, while medications are essential for treating a wide range of health conditions, it's crucial to be mindful of their potential impact on your kidneys. By understanding the risks, recognizing the warning signs, and engaging in proactive measures, you can minimize the risk of medication-related kidney damage and maintain optimal kidney health. Adopt a healthy lifestyle to reduce medication dependency. A balanced diet, Regular exercise and proper hydration can go a long way in supporting your overall health and reducing your reliance on certain medications. For more life-saving information, visit healthtoday.com, subscribe to our channel, and hit the bell icon to